Hello, good evening, everybody. I want to thank you all for joining us this evening. My name is Erick Anderson. I am a registered nurse. I am also the owner and operator of LabStop USA. I've been working as a nurse for the past 12 years. My experience is skilled nursing. And ever since I've become a nurse, I've worked for other people, and I've had to follow their directives. And I always kind of wondered if there's a better way to do medicine. So when I came here to Florida, my wife, myself, and my business partner, Veronica Kolobab, made the decision that we were going to open and operate our own business, and that we were going to do things differently. We were going to do things right. Where came on, it was our number one priority. And while we've been growing and developing, we have been right on top of our game when it comes to testing. So I wanted to do things new and exciting because the same old ways lead to the same old outcomes. So today we're going to be talking about some new amazing testing options that are going to help you to just have the best overall outcome for your patients, clients, residents, whatever scope of practice you're in. This is going to be something that you really want to pay attention to. So again, thank you for joining us, and let's get into it. That first slide you see there, precision medicine, making great strides in healthcare. Molecular biology, aka precision medicine, is not relatively new. It started up in about the 1990s. We had a lot of genetic research going on, and that genetic research led to the discovery of new genes and to the development of DNA sequencing techniques that over time have helped miniaturize and commercialize the testing process. So today, molecular diagnosis is practical and affordable for use in clinical laboratories, making it a fully integrated part of modern medicine. Molecular tests typically detect unique DNA or RNA sequences. These specific sequences may or may not be associated with disease, but they can inform you, the healthcare provider, of drug resistance, genetic predispositions, and the identity of pathogens. Before I move on, I just wanted to touch base on where I said it was affordable. It's important to note that these tests are covered by Medicare 100%, also by PPO and private insurances. They sometimes do require pre-authorization, but the expense far outweighs the consequences of not having these tests. And we'll talk a little bit more of that as we go. So molecular diagnostics or precision medicine are the gold standard for the identification of infectious disease. It has overtaken our traditional testing, especially serological testing. Genetic analysis, it allows for the detection of microbial phenotypes, including characteristics like protein, bacteriophage, biotyping, and susceptibility testing. Many advantages, but the advantages of molecular technique over serology include its sensitivity, allowing for the detection of pathogens at a much lower level. And I'll explain that a little bit in a moment. The ability to find infections early and to identify these infectious agents with genetic precision gives you, the healthcare provider, a critical advantage in providing good patient outcomes. So I said earlier, lower levels, and blood screening using serological techniques alone, they rely on what's known as seroconversion, and that's the generation of antigens in significant amounts to trigger the patient's immune system. But molecular analysis are faster. They have real-time polymerase chain reactions known as PCR techniques. So you as the healthcare provider are able to rapidly detect nucleic acids with a diagnostic effect. One of the most effective areas for real-time PCR has been the diagnosis of infectious diseases and emerging diseases. So PCR diagnosis even allow for detection, ready for this, unculturable or difficult to culture known as fastidious infection agents. I'll say that again. PCR-based diagnosis even allow for detection of unculturable or difficult to culture fastidious infection agents by detecting microorganisms at the nucleic acid level, and the benefits of molecular diagnostics can be seen in pre-symptomatic detection of disease and early effective treatment. This, I said, it's exciting, it's new. It's not necessarily new testing, but it's new to a lot of healthcare providers, and that's why we wanted to provide this education. So the last decade has shown us that molecular diagnostics is more than just a cutting-edge promise of future medicine. Molecular techniques have become fully integrated into patient care. They're being used to bring what was once before unavailable levels of data based on genetic analysis to both understanding an individual's pathology and to prescribing treatment. For this revolution to have occurred, it was necessary for the sciences of molecular biology and genomics to move beyond the research bench and toward availability, affordability, and most importantly, the fast turnaround times that make molecular diagnostics a go-to tool for the widest possible range of uses. All right, so right in front of you right now on the screen, you see the topics for discussion tonight. We're going to talk about molecular urine, UTI panel, respiratory pathogen panel, RPP, gastrointestinal or PCR testing, DNA-based pathogen testing, wound panels, nail fungal panels, two of my favorites, pharmacogenetics, PGX, and hereditary cancer screen, CGX. I may spend a little extra time on that because I like them so much. All right, let's get into molecular UTI testing. Look at the screen. Treatment of UTIs with rapid results, 24 to 36 hours. We all know UTIs are responsible for patient falls, for hospitalization, patient confusion, and in the past, most healthcare providers now are not just administering antibiotics at the first sign of symptom. They really are waiting because the overuse of antibiotics has led to an epidemic, really, of resistance to antibiotic treatments. This is a very important fact I want you to keep in mind. Culture-based testing is what we're doing now. It's time-consuming. It's not always accurate. But here's the thing. So when we're culturing the urine without the identification first of the pathogen, we are at maybe a 30 to 40% false positive reading in just the culture alone. We have a biofilm on top of that culture where we may not be identifying the appropriate bacteria that we need to treat. Chronic UTIs, well, what the heck is a chronic UTI? Does that mean the patient is just very susceptible to infection, or is it possible that we haven't been treating the right infection? Something to think about, something to open up our eyes a little bit. We already know that early identification is going to give us the ability to prescribe the most effective treatment for the patient. The next slide is going to show you some of the pathogens we're testing for. But before I move on, I want to make it very clear that here at LabStop USA, we really like to pay attention to the providers we work with. And what that means to us and what it means to them is that we want to find out what they want, what they need, what they think is going to work best for their clients. In doing such, we really met a lot of resistance when introducing the PCR urines just because of the traditional urine analysis culture and sensitivity. So here at LabStop, we believe in, again, doing what the providers need. So we'll still do that urine analysis, but we're going to use the PCR urine, the molecular urine test to identify that the bacterial agent right away, fast results, more accurate. But upon a positive finding, we're going to also culture that urine. Again, it kind of makes everybody feel a little bit more at ease because it's a system that's been in effect for a long time. So we're, in addition to getting that accurate reading, we're also going to do the culture, which is going to give us the susceptibility. But we're not going to make you wait 2 to 3 days. We're going to have the initial results 24 hours, which is the identification of the pathogen, as well as the resistant markers. But the following day, the next 48 hours, you're going to have the susceptibility. So we're going to know exactly what antibiotic to put your resident client patient on and get them the right treatment. As I said, these are what we talked about already, the rapid results on the screen here, accurate diagnosis. Listen, the better the test, the better the outcome. And here is the test menu. There's a lot of words here I'm not going to try to pronounce. I kind of know how to say them, but don't really want to get into it. So here's the good news, though. Anything that you see or hear tonight, we can get it to you. We can get you a hard copy. All you need to do is request it, and we'll be glad to do that for you. Respiratory testing, RPP. Ladies and gentlemen, this is really not new to you either. This is something a lot of offices are doing in a sense where we're doing rapid influenza A and B. Flu season is among us, so what do? The second they come in with the fever, the coughing, the sneezing, we're going to run that rapid influenza A and B through what? Nasopharyngeal swab. So we're going to get those results. We're going to know if they're positive or negative for influenza A or B. And then we're going to put them on our Tamiflu or so forth and such. But what if I could tell you, we don't necessarily only want to look for the flu. So we want to look for other pathogens. The RPP test does exactly that. I'm going to show you on a couple slides down the road here all of the things we're going to test for. But this RPP testing, again, it's going to look for the infection. What are we going to be dealing with? Again, fast, accurate identification of the pathogen 24 hours after it's been received at the lab. You're going to know exactly what your client, resident, patient has. You're going to be able to get them on the right antibiotic. We're going to slow down the spread of infection. Again, it doesn't matter what your area of expertise is. You may be in family practice, geriatrics, skilled, ALF, wherever it is. It doesn't matter if you want to stop the spread from mom to dad to daughter to sister to brother, or you want to stop it from hitting your whole community. So this is an amazing test. The supplies are delivered to you. We can come out and do it for you. You can do it when you're sitting there with your patient, leave it there at your community or your doctor's office. We could have somebody come and pick it up. But the RPP testing, I think it's great. It's the most comprehensive respiratory panel. Again, fast, 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 and accurate. Fast without accurate doesn't work. So you need both. It's safe, it's non-invasive. And again, the quicker we know, the faster the treatment. Here again are what we're testing for. Again, this is available for you. PCR testing, gastrointestinal testing, GI. Again, GI is something that I really want to touch on here and talk about our traditional way of testing, okay? So when it comes to gastrointestinal problems, viruses are often the most prevalent and least tested for cause. I'll say that again. Viruses are often the most prevalent and least tested for cause. Traditional testing, old school testing for bacteria, while commonly done, is often positive in only 5% or less of cases. So when your clients or your patients are coming in and they have abdominal pain in the left quadrant, a normal loss of weight, sometimes we just think it's the normal aging process or just a little phase they're going through. Blood in the stool. What do we do with blood in the stool? We're going to order a stool sample, occult blood. Let's see what's going on. Yeah, but let's also take a look to see if we got something else going on, a viral infection, colitis, enteritis, gastroenteritis. What about functional diarrhea or diarrhea of an infectious origin? These are some of the things you want to keep an eye out for. Nausea and vomiting. Yeah, it could be something simple, but what if it's a virus? We want to know. Fever, viral enteritis, and non-infectious gastroenteritis. Listen, there's ways of looking at things now from a new perspective. So, again, simple kit, nothing complicated. The swabs are there. We provide them to you. So when you're out there seeing your patients or they're in your office or wherever it is that you're coming in contact with your clients, it gives you the opportunity to get that testing done right away. Get it done. 24 hours, we're going to know what's going on. And we're not going to play that guessing game like we had no choice at some point. And that's really where we sit. Here again, those are those symptoms I was talking about. You could see some illustrations there. Again, why do we do it? Here's the panel right there. It tests for 22 different pathogens. It's testing for the pathogen's DNA. So we're not waiting for the cultures again. Again, fast, accurate testing. I sound like a broken record, but that's really where we're at right now, is explaining to you why we want to do PCR testing and why does it make sense for you and your practice. Here's some references, the Journal of clinical microbiology. This is where they talk about the panel improves clinical management and lowers healthcare costs. Again, that's why insurance is paying for these tests. Here is a bunch of references, again, available for you. Just ask us. We'll be glad to get them over to you. I know everybody's busy, but sometimes we want to know a little bit more about these tests. And I'm just giving you a broad idea tonight. I don't want to bore you with hours of information on how they work and why they work, because you probably tune me out. And I want to leave some time for some questions as well. All right, wound panels. Okay, diabetic ulcers, surgical wounds. Again, depending on the field that you're in, if you're working with the elderly, unfortunately, we see a lot of this with bed sores. They'll come from the hospital maybe, or a lack of a mobility. We may have diabetic ulcers. Really, you want to find out what's going on with these wounds, again, as quickly as you can. Again, avoiding the culture where we're waiting. And I hate to tell you this, I don't know if a lot of you know that most of the wound panels that we send out for culture and sensitivity are being shuffled off to the big chains, LabCorp and Quest, where they're going from one lab to another. They're sitting there, they're waiting, and you're not getting your results. And a lot of times it's 3 to 5 days. You may see sooner results, that's great. But when you're working with PCR and molecular testing, you're working with LabStop USA, we're getting those results. The second we pick them up, they're getting out. And when they're received at the lab in 24 hours, you're going to know what's going on. Very simple techniques. Again, the swab, the collection kits, we provide everything for you. And just here's some symptoms where, some illustrations, and some symptoms to consider. And you guys know all this already. And we're looking for that healthy granulation. But if we're not able to heal it and there's not a diabetic foot ulcer, we want to ask why. Well, maybe we're not treating for the right thing. Maybe the culture we had was misleading, not 100% accurate. Again, results 24 hours when the lab receives it. We have an extensive wound pathogen panel. You're going to see that on the next slide. And again, we're going to give you those resistance markers to avoid ineffective antibiotics. Again, the collection is simple. And here you go, pathogens detected, quite a few. Again, this is going to be your most common. This is what we're going to test for. It's usually in that scope where we need to get in and get out and get this wound treated before it progresses to something that we really have a lot of difficulty in healing. Nail fungus. Okay, nail fungus. Most of us have some experience with it. It's not personal, being out by the pool or whatever it might be. And, we use a generic nail fungal cream. And yes, I know we have over the counter and then we have some prescriptions. But again, we're really not getting specific enough a lot of times. And nail fungus is something that's difficult to deal with. Our collection technique is very simple. It's a tiny little tube. We just need either skin scraping or we need the nail, clipping of the nail. You see an illustration here of a nail clipping. And and if you're working with the elderly, that's not always so easy. But again, it's not a very difficult collection. You get it, we get it out. We're getting fast results here. Some symptoms of nail infection. There's distorted shapes, they're thick. Again, not a normal aging process. A lot of times we see those nails, they're an older. No, these are the things to look out for. And here's the pathogens detected. So you're going to be able to do the nail fungus with us. Again, we want to give you opportunities to take a look at your patient as a unique individual, but not just that. We want you to be able to treat all aspects of that patient. We want you to be able to get everything with us in one shot, get it fast, get it accurate, get it done. I told you my favorite, or two of my favorites, PGX, Pharmacogenetics. And anyone who's a nurse remembers the right drug, the right dose, the right patient, the right time. Well, here it's a little bit different, determining the right drug, the right dosage at the right time for each and every patient. We're taking a look at the unique genetic makeup, okay? How does it influence drug effectiveness? So before I get all technical, if you give me a Benadryl, and I see Veronica's watching here, and you give Veronica Benadryl, and she doesn't take medicine, so that would be kind of hard, but if you give somebody else a Benadryl that does take medicine, in 20 minutes, guess what? If you give me a Benadryl, I'm sleeping. Not only am I sleeping, I'm drooling, I'm sleeping so hard. I have a really tough reaction to Benadryl. You may give another resident, client, or patient the same dosage of Benadryl, 25 milligrams, and it works wonders. The hives are gone, they feel fantastic, and they don't have the same effects. Why? Well, each and every individual is breaking down or metabolizing the medication in a different way. This is nothing new that I'm telling you, but what is new is the ability to test your patient before you administer. PGX testing is covered, and on the right-hand side, it talks a little bit about what's covered. If you have 2 or more medications, if you're taking pain medications, if you're a patient taking medication at risk of developing blood clots, any kind of Coumadin, Plavix, whatever you may be taking, you're automatically covered on this. This test, again, is a no-brainer for the insurance companies because it's going to help save them on medication interactions. It's going to help on hospitalizations. It may also decrease medications. So if you have your client, your patient on a hypertensive, an antihypertensive, or you have them on a statin, and you tell your resident, your client, listen, I want you to change your diet, I want you to eat right, I want you to exercise. And then we run this test and we find out that the statin, they're a poor metabolizer, but their cholesterol is fantastic. Guess what? The exercise worked, the diet worked. We don't necessarily need to keep them on that statin because we all know that statins have a lot of side effects. Things to consider. Listen, everybody is different. We know that. I'm not telling you anything you don't know. What is the right medication for you? This is a once-in-a-lifetime test. Unless they're diabetic, insurance will let it happen more than once. But if it's a once-in-a-lifetime test, why? Because our DNA never changes. So we run this test, we get our report, and I tell my friends, my family, the clients I talk to, I work at a lot of 55 and older communities, I tell everyone, empower yourself in healthcare, get these tests, and make sure you get a copy to every one of your healthcare providers. So if you're the primary doctor, if you're the psychiatric doctor, if you're urologist, cardiologist, this is something that everybody really needs to have a handle on. And this report will go to everybody. And I tell the clients, make sure you get a copy of it. And that goes with blood tests. I tell them that as well, empowering ourselves. But you as the healthcare provider are empowering yourself as well to give your clients the right medications. This is not new again. This is not something that's not out in the public and mainstream. I hear a lot of people, oh, that newfangled nonsense and those reports, we don't need them. Hey, guess what? They're here. Take a look. There's some articles. Personalized prescriptions. That's in the Sky Miles. It's in all the planes when you're flying. That's one of the articles in there. Look over to the right. The veterans to get genetic testing. You read that article. Our government believes in this test, and they want all their veterans tested by 2022. Medications, they're linked to falls. We know that. Medical interactions. We know it's the 4th leading cause of hospitalization and death. So yes, medications are crucial to our clients. But instead of us having to play that guessing game, putting them on Lapressa 25 milligrams, it doesn't work, raise them to 50, raise them to 100, not working. So let's throw in a little bit of a diuretic in there. And then, yeah, it works now. You're doing your best. We all are. I mean, we care about our clients, but if we know in advance on how to treat them and how to do it, boy, oh boy, does it save a lot of time, trouble, and aggravation. PGX is a no-brainer. I think everybody should have it, and I think at some point it's going to be required. Get ready. Do you want to be the provider in the forefront? Jump on board. Get on board. Take a look at this. Again, everything I'm giving you is just a brief introduction. We encourage you to take a look at the articles we're giving you and the resources and do as much information and get back to me. If I don't have the answer to your question right away, I'll get back to you. I'll get the information to you. CGX. Cancer genomics, that ugly word cancer. Everybody knows about cancer somehow, some way. Healthcare provider, patient, it doesn't matter. We're touched by cancer. Now, we know most cancers are caused by carcinogenics. It's just the way it is. Pollution, what we eat, what we drink, the lifestyle we keep, where we work. But 5 to 10% of cancer is hereditary in nature. So what can we do? Well, how do we do this? We want to stop cancer, right? We want to prevent it. And insurance agrees with us. Insurance says, yes, these tests are definitely covered. Anyone who has a personal history of cancer, automatic. Immediate family history. Medicare is paying 100%. I find a lot of the PPOs, they want prior authorization. So before we run the test here at LabStop, we get that prior authorization. Why? Insurance companies know it's a lot cheaper to run these tests than it is to send somebody in for chemotherapy, radiation, and everything that goes along with it. So again, if we could prevent it, we want to. Here's some of the cancers that we're looking at, and you see the picture to the right. Again, a swab. He doesn't look so comfortable, but it's really not a big deal. Cheek swab on the left, 15 to 30 seconds. Another swab on the right. We could run both tests for your clients, the PGX and CGX. You can do it. I could show you how to do it. It's very simple, and we could come and collect it for you. We're blessed to be working with some new providers and healthcare providers, NP groups that are super excited about this testing, and I'm seeing a big influx of people taking these tests. Prevention for the patient, prevention for their children and grandchildren. Why is this slide on here? I'm going to tell you why. A lot of times when I go to these assisted living facilities or these communities where it's 55 and older, I get someone say, hey, I'm 70 years old, I'm 80 years old, and I have one lady say I'm 100 years old. What the heck do I care? Well, if it's family related, it's hereditary. This would give them an idea to let their children and grandchildren know that they are predisposed. Doesn't mean they're going to get the cancer. Let's be completely clear and candid here. This is not a cancer screen that will tell you you're definitely going to get cancer. This is what you need to do. It lets you know if you're predisposed. So what does that mean for you as the healthcare provider? It means you're going to do more screening. So if we have a colon cancer predisposed, we're not going to wait every 5 years for the colonoscopy. We'll do it every year. We'll check for occult blood, breast cancer, mammography. We're going to make sure to give great education and teaching to our patients about breast exams. So again, better quality of life. Listen, if you take advantage of these tests for your clients, you're going to improve their quality of life. There's no doubt each and every one of you listening is already providing excellent care, or else you wouldn't even tune in. You're interested in enhancing your practice, and that's what this does. So, what does this all mean for you and your patients? I've kind of been talking about that all along, but again, PCR, molecular, DNA-based testing. 1990s, it's been developed, it's been enhanced, it's been improved. It's now affordable. It's not over the threshold of being affordable. These tests are very reliable. They're very accurate. There's ways of incorporating them into your daily practice. It is going to streamline your patient's care. It's going to take a lot of guesswork out of what you're doing. And yes, some people will tell me those reports, they're long, they're tedious to read, but what it does is it takes, in the long run, it saves you a lot of time in not knowing what to prescribe, or that guesswork, or those interactions. And we can lose a patient if we're not putting them on the right medication, especially for blood thinners, that clot shoots. So what does this do for you? What does it mean for you? What does it mean for your patient? It means excellent care. How can we work together? If you're not currently working with LabStop USA, we'd be glad to chat with you. Veronica or myself or any one of my staff. I have my phlebotomists out in the field, and they're there, and they've been in service on these tests as well, so they can give you that information. So you want to do them in your practice? You can. I'll send you the supplies. You have everything you need. We'll come and pick it up from you. We'll have a courier come, or we'll come. You don't need us to do it for your clients. You could do it yourself. We could give you the information on training your staff how to do it. Again, everything that we've talked about here today is very simple to do. Nasopharyngeal swabs, epithelial cells from the cheeks, wounds, you know how to do that, toenail clippings. There's nothing here that can't be done in your practice, and I think that your patients would appreciate it. So that's how we work. Oh, look who those two people there. A very beautiful lady and a handsome man. Well, that's me, Erick Anderson. That's Veronica on the left-hand side. I know Veronica is on with us. And Lady V, I'm going to turn it over to you if you'll open it up, and we could open up the floor for any type of questions. I'd be glad to answer them. And again, if I don't have that information, I'll be glad to get it over to you.
Hello, Erick, and a great job. Hello, everyone on the line. Veronica Colabat with LabStop USA. And I just wanted to quickly say before we open up the lines that as far as working together, we are always looking for nurse practitioners that want to help us educate as well. So if that's something of interest to you, we are constantly doing seminars within the community. So feel free to ask me about that, and you're more than welcome to give me a call or to give Erick a call. And I'm going to go ahead and open up the lines right now for any questions that you have for Erick. So be patient with me one moment. I'm going to unmute everybody. All right, everyone should be opened up, so go ahead and ask your questions if you have any, please.
Couldn't have done that good of a job where there's no questions. and if you come up with a question later, don't hesitate. If you don't want to ask the questions now, that's fine. You see our information here. You have our email is there. But again, any questions, I'm here. Please feel free. There's no question that's silly. I'm willing to answer anything I can.